Alright folks, so this week basically we'll be talking about Introduction to Healthcare Information Systems, and so for those who are taking this course, obviously you understand that in the past 10 years in the United States there has been a lot of emphasis of the role of technology in healthcare. There have been many studies done that have shown how involvement of technology can improve healthcare, not only from the patient's perspective, but also from the care provider or the doctor's perspective. So I remember attending a conference a couple of years ago where a lot of the MD doctors were in there, and very renowned and people. And one of the presenters was an MD surgeon from a very renowned health institution, John Hopkins, and he said that healthcare is a puzzle, and if for us to make that solve that puzzle, we have to make sure that all the pieces are put together in the right way. So let me just say that there are so many aspects in healthcare. So when we look from the perspective of the stakeholders in healthcare, there are the physicians or the care providers, nurses, there are the pharmacies, there's the labs, there's the patients themselves, and then there are the insurance companies. And so for healthcare to work for so many stakeholders in the most efficient and most reliable way, there has to be some kind of synchronous actions that have to be put together, and technology can, to a great extent, do that. So this course will talk a lot about the use of technology in patient care, the use of technology from the provider's perspective. And when we talk about technology, our main goal would be to understand how technology can improve the quality and outcomes for patient treatment. So let's look at what, and when I talk about a chapter, I'm not going to focus on all the slides. I'm just going to skim through the slides, but I'm going to focus on the key concepts, the key takeaways from this chapter. One of the things that you have to understand is that for every week you are assigned a chapter or chapters, as well as some readings, and those readings are from articles that are published on topics that relate to the chapters. Those articles are very current and talk about what's the new thing or the in thing as far as healthcare technology is concerned. So let's look at this chapter. It's about the Introduction to Healthcare Information Systems, and you can look at the learning objectives. So what are the types of healthcare information systems? You will be learning about that a lot. And when we talk about healthcare information systems, one of the most important aspects of that can make healthcare information system work is patient data, or health data, as some people like to call it. HIPAA, you'll hear the term HIPAA a lot. HIPAA is about data protection for patients. HIPAA, it's a law. It's put together by Joint Commission. By the way, Joint Commission is the body, the agency that is the ultimate as far as healthcare laws are concerned. So for a hospital, if there's a Joint Commission review, and the hospital clears that review, that's it for them. So it's the gold standard, if you will. So HIPAA is basically a set of laws that have been put forth for doctors, nurses, physicians, insurers, healthcare providers, even patients, to secure health information. Okay, so there are a set of rules that physicians have to follow, that hospitals have to follow, that pharmacies have to follow, that labs have to follow, that insurance companies have to follow to ensure or secure health information regarding patient. You learn a lot about HIPAA as we go along the semester. There's National Health Information Technology, which talks about electronic medical record, and Just to put it in straight words, so patient data about patient's health record is electronically um, stored, updated, and shared. That's electronic health data. So nowadays, for those who are visiting doctor clinics, maybe your primary care, no longer they maintain a paper based file for you. It's all electronic, and they have to do it electronically because the law mandates that. Personal health record is basically a portion, the entire history, entire patient history, starting from when that person was born to date. Okay, so these terms are interchangeable. Some people use electronic medical records. Some people use the term personal health record. One of the most important things in when we talk about health information technology is patient data. Okay, and HIPAA is all about securing patient data. Purpose of patient records, just basically from sharing to billing to etc. to many things. So, for example, you go to visit your doctor, and the doctor prescribes some lab tests, and the doctor just sends those lab tests electronically over to your lab. The lab knows that you need these tests, and when you show up at the lab for blood work, they know exactly, okay, XYZ needs these kind of blood tests, and all the results of the blood test, and then updated to your personal health record for your physician to see. So the physician, your PHR is shared between your physician, your lab, your pharmacy, the hospital that you may be going to for inpatient care. So basically, your personal health record is floating around. It's being shared by all the care providers, all the entities that are basically somehow or the other involved with your health. That includes your insurance company, health insurance company too, for billing purposes. Patient-specific data, that could involve patient-specific data, your lab tests, your x-ray reports, your pathology reports, and it could contain any information that is related to your health. One of the key things to remember is that healthcare as an industry, it's complicated, if you will. There's so many parts to healthcare. Just think about yourself as a person visiting a physician. You visit a physician, you go for a checkup. What you do at the front desk is you show your insurance card, they make sure you have insurance, you co-pay, you make your minimum payment, and then you go to see the doctor. The doctor sees you, gives you an A on your health, but says, okay, well, you know what, I think that you may want to get your lipid profile done. Okay, lipid profile is cholesterol profile for simple terms, and then so that lab test is sent electronically to your lab, and you go to the lab. The lab says, okay, XYZ is here for these tests. They do the blood work, then you walk out. Your results are sent to your doctor. The doctor looks at that. Everything looks normal, and all this information, while everything is going on, is updated on your PHR. At the same time, maybe the doctor has ordered a prescription drug for you. So during your visit, so that prescription drug is that information is sent to your pharmacy. You show up at your pharmacy. They already have all your prescriptions. They just, hey, you give your name, your date of birth, you verify your identity, and then if you have to pay your copay for that prescription drug, you take that and you walk out of the pharmacy. Of course, we've talked about the insurance company. So you see how many things are working at the same time, and just imagine all this information has to be shared between so many entities in so many different ways, and there are codes for information sharing, So when we talk about data needed for reimbursement, that's UB04, that's the code, that's what your insurance company needs for reimbursement. Now, the thing is, when you visit a doctor, remember, you're visiting a physician, and the physician may charge you $300 for that visit, but you are only billed your copay or that minimum. So the doctor needs to get reimbursed for that $275 balance, and so your records, when they send your visit record, they have to send the proper information to the insurance company so that the insurance company can reimburse your doctor for that visit. Now, uniform hospital discharge data set elements. So if you're an inpatient, there are other aspects to it. They have to make sure you're, now these are all, this information is needed for your billing purposes. There are patient specific data. ICD is basically a coding system. Now remember that from October, the ICD-10 is going to become mandatory. ICD-10 is a complete rehaul of the ICD-9. This is a coding system that is used for billing, used for many other purposes, okay? And we'll talk about ICD later on. So it's the first chapter is just giving you sort of a superficial idea of what are the topics that you will be running into during this course. So having said that, let's look at some of the things that you have to understand, or you have to know. Is, like I said, Joint Commission is like the gold standard. Okay, if they approve something, that's it. It's you're good. CDC, Center for Disease and Control. They're kind of a research body that basically keeps a tab on what's going on in Americans' life as far as the health is concerned. So, for example, they will conduct studies. They will report about the spread of diabetes, or how many people smoke, or what's the percentage of smokers in the United States, how much has gone up, how much is reduced. So CDC is kind of it keeps a tab on the health of America, if you will. There are other agencies like the NCQA, the AHRQ, but usually you'll hear a lot about CDC. You'll also hear about CMS, for Center for Medicare and Medicaid Services. Now, Medicare and Medicaid is one of the most, the largest, if you will, entitlement programs in the country. Medicare is for older people, 65 or above, and Medicaid is for people with low income. Now, you'll hear a lot about CMS. There's an organization that basically handles Medicare and Medicaid. And Medicare and Medicaid is paid for, by the way, by taxpayers' money. So this is chapter 1, and like I said, this is basically a summary of some of the topics that you'll be looking at. This week you'll also be looking at chapter 4, so let's just kind of see what chapter 4 has to offer us. So it's the history and evolution of healthcare information systems, and it's interesting just to understand the history. And when we go back, we look back in the 1960s, there was some people started talking about change in healthcare, the way healthcare was done in the United States, and one of the key things in this chapter is the administrative information system. The difference between administrative information system was the clinical information systems. And clinical is mainly the patient relevant to patient, diagnosing, treating, monitoring patient. History of HCIS, healthcare information systems. What is happening in healthcare environment at the federal level that influence organizations to adopt or use computerized systems. What was happening at the state level, how did environmental factors coupled with the advancement of technology impact the adoption of healthcare information systems. So there were many factors, back in the 70s and 80s, there were all people talking about, hey, we are lagging in healthcare. We are the United States of America, the most advanced nation in the world, the richest, but we lack in terms of having the right equipment, the right technology to take care of our patients. And by the way, America spends the most amount of money per capita on healthcare. However, it's ranked 18th in the world in terms of quality of care and patient outcomes. Switzerland is one of the top most countries as far as healthcare is concerned. Now, having said that, there are a myriad of reasons why that is so, that we are the most expensive yet ranked 18th. Apparently, technology has been able to resolve a lot of the issues and keep the costs down for healthcare over the last 5-10 years. But there's a lot to achieve. There's a lot going on in terms of technology's role in healthcare. And as you read the chapters, as you read the topics, as you read the articles, you will realize that what we are doing today, we've just started in terms of technology enabling healthcare. There's so much more that technology can do for healthcare. In the 60s, there was this healthcare environment. We can talk about that. I'm just going to jump to the 80s where things started to really move. In 90s, that's when this thing started to happen. The Clinton administration really got down to business, and they said, hey, you know what? We need to change healthcare. We need to change the way doctors look at patients. We need to change the way insurance companies bill doctors. We need to change the way insurance companies bills patients. We need to change the way pharmacies function. So there was a lot of things going on, and one of the things that I as a follower of history of health information technology and a person who's been looking at this topic for the past 5 years have come to a conclusion that what had happened in the last 5 to 8 years in healthcare information systems was a direct impact of the initiatives that were started back in the 90s. So there was this unveiling of the internet. Internet became pervasive, and people said, hey, you know what? Let's look at technology and how technology can impact healthcare. 2000, of course, there was a lot of things. The Institute of Management came out with a report reporting the patient safety and number of medical errors, and also that report, that was a very famous report. You can read IOM 2001, I believe, if you Google. That came out with the fact that what technology can really do, and that was one of the earliest studies that was done to understand how technology can positively benefit healthcare. So there's a lot of things going on, and as you read the chapter, you'll understand how things evolved. And now in the 2010, when the current administration, 2015, current administration came, they made a lot of things. The Affordable Care Act came in, the meaningful use. Now you'll use the term meaningful use. There's a chapter that we'll talk about the term meaningful use. Basically, simply put, meaningful use is okay, there's technology. Is that technology being used effectively to take care of the patient? Whether it's a wearable device, whether it's your Apple Watch, whether it's a mobile health app, whether it's your personal health record, whether it's any kind of technology, is that technology being applied to take care of the patient's health condition? That's meaningful use in simple terms. And then we talk about ICD-10, all kick in. Now, ICD-10 is being mandated. Like, there was ICD-9, that was the earlier code, now it's ICD-10, it's mandated. Every doctor, every hospital, every care provider has to adopt to ICD-10. And then, when we look at the last 5 years, 2010 and beyond, and later, look at the HITECH Act, which is a part of the HIPAA. You look at this, it's specifically focused on the aspect of technology's role in healthcare and how technology can secure patient data, healthcare data. So in the sense, these two chapters kind of introduce you to what healthcare information system is, sort of give you a sense of the history of healthcare. And like I said, every week you will have a couple, 3 to 4, ranging between 2 to 4 articles that are relevant to the chapters, the textbook chapters that you will have to read to increase your knowledge base, to answer the questions that I'll be asking. But most importantly, to increase your knowledge base. Okay. So let's look at this article, Healthcare Information Technology and Fallacies. It's an 8-page article. Most of the articles will be between the 5 to 10 pages. Easy read, interesting. Talk about practical implications. So this when you read this, the current research suggests that rate of adoption of HIT or healthcare information system is low. So this talks about, okay, what are the fallacies and implications of design, and if you look at this, most importantly, I mean, I'm just skimming, and I'm just trying to tell you that, look, you got to read the whole thing, but if you, I'm just going to talk about the gist, okay? So a couple of things. Designers of healthcare need to have a deep, rich, and nuanced understanding of healthcare. However, it is misguided to believe that healthcare is unique, that no one outside of the domain. So one of the things that, and this is, I have heard from a lot of doctors, care providers, nurses, experienced, new in the business, that a lot of the technology that is coming into existence or into play to help the doctors, to help the nurses, to take care of patients, is too complicated or doesn't serve their purpose. They're designed in a way that is actually impediment to their work. So what do we do as designers, as software engineers? How do we resolve the issue? It's simple. Make it simple for the user. I mean, why is Apple Apple? Why is Steve Jobs a legend? Because he understood that people wanted devices that made things easy for them. iPod, iPhone. Go back 1980s, Bill Gates. I mean, why is Bill Gates Bill Gates? Because he understood back then that people need easy computer systems, easy to use computer systems. Same thing with HITs, or healthcare information technology. So what I'm trying to say is that when I direct your attention to these articles, I want you to take the gist out of these articles. I mean, I want you to read the whole thing, of course, but I want you to say, okay, I have A, B, C, D are my takeaways from this article, and that's when you've achieved the goal of reading this article. Let's look at promises of HIT. It's a 7-page, and it talks about what it'll take to achieve the as yet unfulfilled promises of healthcare information technology. And I'm skimming down to the conclusion. Talks about fully operative, patient-centered, easy-to-use systems. Ultimately, there's only so much the government can do. Providers must do their part by engineering existing processes to take care of full advantage of the efficiencies offered by health IT, and so on and so forth. So again, it talks about improving the design of technology, making sure that it's actually helping the patient rather than making complicated software systems that the doctors cannot use. It becomes an impediment for their work, and 2 months later, doctors stop using it. Then you have this article, U.S. healthcare industry. This was something that I would like you to read. This is a McKinsey report, very well written, very short. It talks about the general environment of healthcare. It's a 2014 article, so it's pretty recent, and it gives you a sense of what the U.S. healthcare system looks like, what is the current status. I mean, just skimming through this, look at these graphs here. I mean, industry leadership volatility, okay. Then disruptive changes in healthcare industry, very important. We talk about disruptive technologies. It talks about disruptive technology. Look at that, cumulative real per capita growth and national expenditure versus GDP. Look at that, how it's growing. It's growing at such a significant rate that it's scary, the expenditure, okay, and it's becoming scary, okay. And this is one of the reports that I love, because it tells me, I mean, if I am a person who wants to know and understand where healthcare industry is in the United States, I just spend about a half an hour reading this report, and it gives me a sense of what the health of the healthcare industry is in the United States. And it talks about at the end what needs to be done in order to succeed. Last but not least, this chapter on role of information technology in healthcare. This is a heavy read in terms of it talks a lot about personal health record systems. It talks about the HIPAA, the rules, the laws, the regulations. But it'll also give you a sense of the future directions of healthcare. So look at this, social media and healthcare. That's one topic that's really, if you will, trending. Okay, then you look at evidence-based medicine, or EBM. People are talking about EBM, or evidence-based medicines, like, okay, if I use this technique or this technology or this clinical procedure, do I have data to prove this is working? That's evidence-based medicine for you. The consensuous, explicit, and judicious use of current best evidence is making decisions about the care of individual patients. EBM is an idea that goes back decades but has been gaining increased attention among researchers and popular press as a tool to address concerns about healthcare costs and quality. EBM stands in contrast to anchoring decisions on personal habits, tangible and intangible incentives unrelated to healthcare, or medical traditions that have little or no empirical validation. So it's all about evidence-based medicine, as the name suggests. It's all about empirical validation. So if we introduce a technology to take care of diabetic patients, how many patients in what time and what period are able to see an improvement in their diabetic condition? Do we have empirical validation or evidence for that? If we have it, that's part of your evidence-based medicine. So this chapter, personalized medicine, again, it's means using knowledge about an individual's unique physiological makeup and medical history to tailor treatment to his or her likes or dislikes. Okay, a lot of people like to call this as patient-centric treatment, where you really have the involvement of the patient. So let's say, for example, you're treating two diabetic patients. One is a 21-year-old college-going person versus a 70-year-old retired. Would you approach would you approach care of treatment for both of them in the same way? Would you be telling both of them, hey, you need to work out 5 days a week? That's not going to be possible for a 70-year-old. So what do you do to make sure that the 70-year-old is locked in, as the same way as the 21-year-old is locked into your treatment plan? What do you do that? So you personalize the treatment based on that person's background, that person's perceptions, physiological makeup, and what you do is, that's how you achieve patient-centric care. Okay, so that's one of the things that is the takeaway from this this article. So having said that, so every week I have this video for you. I will talk a little bit from the chapters, the slides. I will also give you kind of a gist of the articles that you'll be reading, so you get a sense of what this is about, and why am I studying this, and try to connect the dots. Okay, you read about personalized medicine, you read about evidence-based medicine, you read about social media and healthcare. How do these things really work together? I mean, who is benefiting? How are these really working for us, and all that stuff? So with that said, this concludes the video for this video. Good luck.